Hello everybody, my name is Despina and today we're going to talk about flexibility and sit and reach test. What are muscles? Muscles are soft tissues. Many stretchy fibers make up your muscles. You have more than 600 muscles in your body. Different types of muscles have different jobs. Some muscles help you run, jump, or perform delicate tasks. Other muscles allow you to breathe or digest your food. It is generally known that flexibility has long been considered as an important component of physical fitness and good health. Also, the definition of flexibility is the range of motion available in joint or group of joints. So why flexibility is an important component? Leming Kemper Matthew 2004 gave 4 different reasons. First of all, it can be recognized that one of the most common medical complaints in America is low back pain. Statistics accumulated that in medical centers indicate that many, if not most, back problems result from weak or inflexible muscles. The prescription for such problems is a lengthening strengthening program for the muscles. Most experts agree that in addition to strengthening the abdominal and back muscles, a flexibility program for lengthening the iliopsoas lower back and hamstring muscles is important. Mishor-Varga 2012 said that a good level of flexibility of the hamstrings and lower back, it plays a key role in health-related fitness. Also, flexibility has been defined as the ability of muscle to lengthen to allow one joint or more than one joint in series to move through a range of motion. Loss of flexibility is defined as the decrease of the ability of the muscle to deform. Also, some of the purposed benefits of the enhanced flexibility are reduced risk of injury, pain relief, and improved athletic performance. Stretching programs now help flexibility, also have physiological benefits such as increased blood flow to the tissues and increase the speed of muscular contractions and nerve transmissions. Also, stretches of longer than 30 second duration with a lower force provide increased tolerance to stretch, improve flexibility of the hamstrings, and improve quadriceps eccentric contraction. A flexibility or stretching program is aimed at the increase of range of motion of specific joints or group of joints. Stretching results in elongation of soft tissues and increase in muscle length, which affects the stiffness and the energy storing properties of the soft tissue. The 3 types of stretching that help flexibility are ballistic stretching, proprioceptive neuromuscular facilitation, and static stretching. Ballistic stretching now is technique involving rhythmic bouncing motion. The bouncing uses the momentum of extremity to lengthen the muscle. Proprioceptive neuromuscular facilitation involves the use of brief isometric contraction of the muscles to be stretched before statically stretches the muscle. Static stretching, considered the gold standard for measuring flexibility, is elongating a muscle to tolerance and behind the position for a length for time. The sit and reach test was developed to measure hamstring and lower back flexibility. Your hamstring muscles are located in the back of thigh, starting at your hip, inserting to the knee. Hamstring tendons attach them to bones in your pelvis, knee, and lower leg. The 3 hamstring muscles are biceps femoris, semimembranosus, semitendinosus. So here we can see hamstrings, semitendinosus, semimembranosus, and biceps femoris. As we mentioned before, the sit and reach test was developed to measure hamstring and low back flexibility. It was described by Wells and Dillon in 1952. This test is most probably the most used flexibility test. It has a simple procedure, is easy to administer, requires minimal skills training for its application, and the equipment necessary to perform the test is affordable. Furthermore, it is also a field test which is easy to administer in a community setting with a large scale of population size. According to the meta-analysis done by Vega 2014, sit and reach tests have moderate mean criteria-related validity for estimating hamstring extensibility. Thus, evidence has shown that sit and reach tests have moderate mean criteria-related validity for estimating hamstring extensibility, and classic sit and reach test protocol seems to be the best estimate hamstring flexibility. Equipment required: sit and reach box, box meter, ruler, tape, and an assistant. So the procedure now. Shoes should be removed. The test involves sitting on the floor with legs stretched out straight ahead. The soles of the feet are placed flat against the box. Both knees should be locked and pressed flat to the floor. The tester may assist by holding them down, with the palms facing downwards and the hands on the top of each other or side by side. The subject reaches forward along by measuring line as far as possible. The hands remain at the same level, no one reaching further forward than the other. After some practice reaches, the person reaches out and hold that position for at least 1-2 seconds while the distance is recorded. Make sure there are no bouncy movements. Repeat 3 times and record the best record. The body has to be 2 fingers away from the wall. Also, should be someone hold the seat and reach box. Our participant is a goalkeeper. For the current test, our participant results show that is at an excellent flexible position. This table here will help us to analyze the results of our participant. Is the elaboration of the results of the specific flexibility test, sit and reach. We have these categories here: excellent, good, average, below average. The participant ranked here to the excellent fitness category because of her results. She achieved her higher record was 47 cm and is classified in the excellent category here.